The brain is just an organ, and it gets ill just like the kidney does or like the pancreas does. The more severe the depression is, the harder that is to do. TMS actually stimulates a particular part of the brain. Most people can be turned around and have really good results.
Hello, welcome to Mindset to Results. Today our guest is Dr. David Kent, a board-certified psychiatrist and founder of NUMI TMS clinics. With over 35 years of clinical experience and training under leading neuroscience researchers, David explains what actually happens in the brain during mental illness and how cutting-edge technologies and treatments like TMS are reshaping recovery. Hi, David.
Hi, how are you?
Great, thank you so much for coming and sharing your knowledge and expertise on our podcast. I'm sure that our listeners will get so much value from this episode. Before we start with the questions and go deeper about your treatment and how you help so many people with mental illnesses, I would like you to share a little bit about you, how it started. How did you find this passion to help people in this direction? I believe it was something in your life that you discovered and you want to help other people.
That's a great question. It's a journey, life is. So, we have lots of turns and we make decisions and things happen usually for a reason. I've been doing this for 35 years, but I had to make a decision along the way. Psychiatry is a medical specialty. So when you're in your third year of medical school, you rotate through all these different specialties of medicine, surgery and family practice and anesthesia, all these things. Psychiatry was not on my radar. It wasn't something that I was thinking about or even knew anything about whatsoever. So I rotated through it and it turned my head. I realized that it was a very effective field and I like people. So it was just kind of a perfect fit. And looking back on it, I really felt lucky that I made that decision because it was a perfect fit for me. Because it's, you're taking care of people that sometimes have really terrible circumstances and terrible situations. But through practice and education, I've learned that most people can be turned around and have really good results for the most part. And that's the satisfying part of it.
Yes.
So that's kind of how it happened. But I also got influenced by other doctors and they were very enthusiastic. And so I just kind of committed to it in one day. It was like I just knew this was for me, and I didn't waver after that. It was always like my direction. So it happened during my third year of medical school, and then I just kind of stayed hyper-focused after that.
Yeah, thank you for sharing. After 35 years in psychiatry, what is the biggest misconception intelligent, high-functioning people still have about depression and serious mental illness?
Well, that's a good question. I get that asked a lot, and it's a good thing to talk about because I think one of the misconceptions about a lot of these things, especially depression, is that somehow we can think our way out of it, or we can talk our way out of it, or we can eat our way out of it, or we can exercise our way out of it. And where good lifestyle habits are really important for all of us, and even people with depression and mental illness, the more severe the depression is, the harder that is to do. In fact, if you have a really severe depression, exercise sometimes can make you feel worse because you're already tired to begin with, and it's hard to pull yourself out. So I'm not saying you shouldn't have good health habits no matter what, but that's not the way to get over it. These conditions have found to be highly genetic, so there's a very big biological component. That's why biological interventions are so critical. We start with medications, but if they fail after a while, other options should be considered. And today we have a lot of options available. We didn't have as many when I started out. We had mainly just medications. Now in ECT, which is electroconvulsive therapy, but now we have TMS, which we're going to talk about. TMS stands for transcranial magnetic stimulation. It was discovered actually in London by Anthony Barker, PhD physicist there in London. And Mark George, a psychiatrist, neuroscientist, was in London at the time, heard about the discovery. And between the two of them, they developed the technology that we have today. They are considered the founders, the fathers of TMS, and they've gotten lots of awards for it. What TMS actually stimulates a particular part of the brain. We call it a circuit. It's like taking it to the gym. And if you look at brain imaging, you can see that those circuits are underperforming. They're not very active. So by stimulating those circuits repetitively, like taking it on the treadmill, that part of the brain somehow gets stronger. And scientists have shown that the actual connections in that part of the brain actually become more numerous. And that's referred to as neuroplasticity. And so for depression, it's kind of we start with one place. If medicines work, great. And psychotherapy is helpful. Psychotherapy is really helpful when patients get more stable. It gives them some tools to work with. But if the medicines are failing, then it's time to start thinking about TMS. ECT, electroconvulsive therapy, is usually later on if everything else is failing. It's a very powerful treatment, but it also is invasive. It requires anesthesia and things like that. So those are some of the things you can do, but we have to recognize, I think I want people to recognize how biological depression is when it settles in. Now, we all get depressed from time to time, or we have life events happen, but usually those don't last forever. They may last weeks or maybe a few months and go away on their own, and that's different than what I'm talking about. The types of depression I treat last years and often decades or lifelong, and it settles in, and that's the real danger because people lose their lives essentially.
Yes, it is such a great technology which you shared about. And could you please share a little bit more, like how it is applicable? Like, what is that technology? How
I mean, the TMS?
Yes.
Yeah, the TMS they basically use an electromagnetic device. It's like a type of electromagnet, but it has a very narrow sort of beam of stimulation. And scientists have now determined there's different circuits in the brain, and they've even identified what circuit does what. There's 3 circuits in the brain that are amenable to depression treatment. And so we also use it for OCD now. It's been approved for OCD, and I've been doing that since 2018. And so it has other uses. Off-label, there's many things it's being studied for. But on the depression side, the research is really extensive. And that's the thing people don't realize because most people haven't even heard of TMS. If I mention the word, they go, "What's TMS?" So the average person doesn't even know what it is. But in the research world, it's well known. There's probably well over 100,000 papers published worldwide related to brain stimulation. So that's an enormous amount of research, more than the medications, more than anything else that we've studied. So it's highly researched. So it's not like we don't know anything. And what researchers have determined is by stimulating a circuit in the brain repetitively, like you're exercising a muscle on your, like say your bicep, it gets stronger and actually gets bigger. They've shown that the number of connections in that circuit increase in number. And this is all hardcore research. So it's not like, well, maybe. It's not really a maybe. It's really, we know this. So when TMS works for somebody with depression, the nice thing about it is it has what we call durability, meaning that the results can last for months or even years, and sometimes indefinitely. So some patients can become med-free with it, and I've seen that over and over again. So that's the exciting part. The other thing about TMS, which is great, it's such a powerful treatment, you'd expect it to have side effects. But have never been found through all this research for TMS to have any long-term side effects, which is amazing. No personality change, no memory issues, none of those things. In fact, when it works, I call it true normal. People can become med-free and feel what it's like to be truly normal. And I can't do that with a lot of other treatments. So it's really powerful. It's also effective for OCD, and it reduces the symptoms of OCD pretty well, especially when medicines are failing. So it's really a nice tool to have available.
Yes, it is amazing that today you're sharing, because I'm sure that so many people nowadays, especially in England, thousands and thousands of people have depression, anxiety, and what you shared, it is really can save so many people's lives.
Thank
And
you. Yeah.
yes, and you mentioned about the treatment. Is this a device that people can use, and is it portable that they can put in his pocket and walk and have that?
No, it's not that type of device because it uses pretty powerful energy to cross over the skull into the brain. So it's not something you would want to do it yourself type thing. People have tried to develop that, and maybe there's some things out there, but from my own firsthand experience, it's like the machine I use is you can't even. It's really heavy. It takes two people to move it around. And so, versus that, and it's also very, very expensive. It's over $200,000 for just for the machine. So, for someone to want to just purchase one and have it in their house, no, they wouldn't want to. So, you have to go to somebody who's experienced clinician in this and trained in it, certified in it. They know what they're doing, because there's some nuances to it. I've probably treated over 900 patients with TMS, so this is one of my specialties, one of my major specialties. So I wouldn't suggest anything but an expert, somebody who's really done a lot of it.
Mhm. Yes, and do you have patients from UK or from other
I
countries?
don't, because I'm so far away. I'm over here in Idaho, so I'm clear over. I'm too far away. I do get out of state patients who come to see me because they hear about me and um, figure they want to go to somebody who's done a lot of it. Um, but I know Dr. Barker. He lives in London. He's now retired. Um, he's really highly respected. Um, it was funny how he discovered TMS in 1985. I call him the English tinkerer, the scientist tinkerer, because the way he discovered it may not be approved today, but it was great because he discovered an incredible technology, and it really has developed worldwide now, and we're discovering new uses for it, but depression and OCD are the primary ones right now.
Yes, that is good. We might invite those experts also and create another panel discussion to discuss this topic even more deeper because I believe that it is so much important nowadays to help people. In your book, Why Me? The Brain on Tilt, you describe mental illness in biological terms. What does it actually mean when the brain is on tilt? And what is happening neurologically?
Well, tilt has a lot of different meanings, but it usually means off balance, right? You're tilted over. Um, I used to play poker for about 20 years, and so it's a term in poker where you try to get the opponent on tilt, they call it, where they become more emotional or angry or upset, and then they start making bad decisions. So it's getting them on tilt. So it was kind of an homage to that a little bit. The brain on tilt, you're trying to get somebody off. When people have mental illness, they're a little on tilt. They're off. Sometimes they have a lot more emotions. Their emotions can run the gamut. And so it's kind of like that. So that's kind of why I use that name or that reference. And why me is really, I think, pretty self-explanatory. People who come down with illnesses, even medical illnesses, often ask themselves, why me? Why do I have to have this? And so that's the same with mental illness, because to some people it feels like a death sentence, but it's not. It's not a death sentence, but it's just how people feel and how they react when they first get a diagnosis.
Mm-hmm. And what is happening neurologically? Like
Well,
what
that's
situation?
That's a big question because there's different disorders we treat: depression, bipolar, schizophrenia, lots of different mental illnesses, and OCD, of course. We don't completely understand every last detail, but we understand that because medications are effective, we have make some assumption that there's some chemical basis for it. That's why medicines are helpful and quite helpful in a lot of cases, and sometimes essential because schizophrenia, you can't get by without medication. Bipolar, you cannot. Schizoaffective disorder, which is a type of severe bipolar, requires several types of medications. OCD typically requires medications to get better, but there is, like I said, a TMS protocol that's also helpful. So we know because of our kind of the way treatment works that biological interventions are doing something in the brain. So we have all these neurotransmitter systems like serotonin, norepinephrine, dopamine, GABA, all these different systems. And so but we don't know exactly how still. And then that brings us to brain stimulation. ECT uses electricity to stimulate the brain under anesthesia to go into a grand mal seizure. And somehow that seizure is therapeutic for depression. And we have no idea why. And we've been using ECT since the 1950s, so you'd think we would know. Maybe there's some theories, of course, but we don't know exactly how. That brings us to TMS. TMS uses electromagnetic pulses to stimulate a particular very narrow part of the brain called a circuit, and it repetitively stimulates it thousands of times. So it's like it's turning it on and it turns off, turns on, turns off. So you're like exercising it. Mm-hmm. We do know with TMS that the number of dendritic connections, which are the fibers that run through the brain, increase in number. That's been shown. So that neuroplasticity piece is something we do know. And so that begs the question of, what is mental illness? Is it anatomy? Is it chemistry? It's probably both, depending on the disorder. We're starting to realize through brain imaging and other tests that we're seeing evidence of this. So, for instance, with TMS, if you have success where you treat someone's depression over time, MRI research, which is a type of brain imaging, has shown that the amygdala, which is a limbic structure in the brain, in the limbic system, deep in the brain, actually gets bigger. So that's an anatomical change shown by brain imaging. So we can actually see some of these changes. We can also use other types of brain imaging to see where the brain is underperforming. But scientists are working very diligently. They talk about these different circuits and these different paradigms and how the brain actually functions. So it's an exciting future. I think we'll know a lot more, but we know a lot more than we did when I started. That's for sure.
Yes, and when people go for TMS treatment, how long it takes usually? And also, do they feel anything from that pulses, impulses, electromagnetic?
So that's a good question. In the U.S., insurances cover almost universally 36 treatments. And when I use a BrainsWay device, there's two different types of devices, but I use BrainsWay. Their protocol is 20 minutes a day, 5 days a week. So it's about 6-7 weeks of treatment. You start seeing results anywhere from the beginning right away, which is not that usual. Usually you start seeing results by treatment number 10 to 15. And then after that, it starts to get better and better and better. Sometimes you don't see results at all. And so there's 2 other locations in the brain that are associated with depression. So we can pivot to one of those locations and see if we get better results. Unfortunately, it's kind of trial and error that way. There's no way to predict exactly which circuit you should start with. But we start with the one that's typically the most responsive and kind of go from there. So, and then about 20% of people don't seem to respond to TMS at all. So we have to consider other options. But that means about 80% do have some favorable response to TMS, which is very high. It's a very good result. 50% in my practice will go into complete remission. And that's pretty outstanding because everybody who comes for TMS have typically failed many trials of medications and psychotherapy and all kinds of other treatment. And sometimes they've been suffering from depression for many decades. So for them to respond after all of that is pretty amazing. And so it kind of underscores that it's a different mechanism with TMS. It doesn't matter if something else didn't work. TMS may still work. And so it gives people a lot of hope that there's options still.
Yeah, that is great. So do they feel anything from devices when?
Well, yes. The treatment, because we're using real energy, sometimes initially they can be uncomfortable. The scalp muscles can feel it. So headaches are the most common side effect with TMS, but they seem to go away within the first 5 treatments. And you can take Tylenol or Advil or something beforehand to mitigate that effect, but that will go away. The second most common side effect with TMS is a little bit of fatigue or tiredness afterwards, and that also goes away. It's not disabling, it's just something that's noticeable. Very, very rarely TMS can cause a grand mal seizure. I've seen a handful over the last 11 years, but not very many. They're treatable. We just turn the machine off, the seizure goes away. It doesn't cause epilepsy. It's not anything to fear. In the past, we would have to stop treatment at that point, but we now have a protocol that doesn't cause seizures that we can go to. And I've done that a time or two.
Yes, yes, such a really great hope for many people. Many high achievers can function at a very high level while internally struggling. How can someone distinguish between normal stress and the early signs of depression or polar disorder?
A lot of these disorders, depression and the other ones, are very persistent. That's kind of the key word. They don't go away. Someone starts struggling with depression and all the things they try, whether it's exercise, eating right, surrounding themselves with great people or whatever. If those things are failing, then it's time to go see a professional because it'll sink in. It has like tentacles, so it can settle in really bad. And so it's, in the US, the DSM criteria, which is what we use for diagnosing mental illness, in order to diagnose major depression, you only have to have 2 weeks of symptoms. To me, that's a little fast to dive into treatment. It depends. If they already have a history of depression, then you should get treating it. But, if it goes on a few months, then it's time to come in, time to get some help. And it sort of depends on the severity too. That's, postpartum depression can be very severe. So that's something you have to jump on right away because it can get really severe. It's people say, well, how can you be depressed? You just had a baby and this and that. It has nothing to do with that. It has to do with biology and something to do with the hormonal changes associated with that postpartum period.
Yes, and you mentioned that people with mental diseases, they also, if they don't get help on time, they can end their lives. So, how depression turns into intrusive thoughts about suicide? Like what it shows, like what when people start getting such thoughts, what it shows, what is going on in the brain, why the brain turns this mechanism to kill themselves.
Well, it has to do a lot with the feelings of hopelessness that people begin to develop when they're depressed. In fact, I always ask every depressed patient, are you feeling hopeless? And that's an indicator of a risk factor for suicide. There's other risk factors as well, but the longer the depression persists, the more hopeless people become because they feel like they can never get out of it and they're trapped. And they don't want to feel that way forever. And so it's a really critical thing to get someone like that treatment as fast as possible and also provide hope that it is treatable. We can get them better in some fashion. So hopelessness is a really big thing. And so in suicide, we see it all the time in society. We're in the news, we have celebrities and celebrities' families and taking their life. We just had it this past week here in the US. A celebrity's family, daughter just committed suicide, which is a terrible thing. It's a terrible thing. And so in the US, I don't know about the UK because I'm not familiar with the data. In adolescents from age 15 to say 25, 27, the second leading cause of death is suicide. The first leading cause of death is accidents. They're an accident-prone group. So it's very serious. We have to get people treatment early. Unfortunately, most people don't get treatment for mental illness for up to 6 years or several decades sometimes before they ever seek help. And the problem with delaying treatment is the treatment itself may not work quite as effectively unless we jump on it pretty early. It still works, but it works better when we can jump on it immediately. It's like we're going to catch it and we're going to tell the brain, hey, don't go there. We don't want you going there. And so getting in treatment early, and that's why I've decided to write a book, is because awareness is such a problem. I can talk about TMS, and if I went on the streets of London or in the UK, I said TMS, people look at me sideways and go, what's TMS? 99% of people probably wouldn't know what it is. And so there's a huge awareness problem in my field. That's its biggest problem. And I couldn't find a book out there that really spoke to the average person about mental illness. And that's why I finally decided, well, I better write a book then. And that's why I did that. And it's been very well received. I have it at a psychiatric hospital I work at, and the patients have given me enormous feedback on it. It's given them insight. It's motivated them for treatment. They listen to every word I say at this point because they feel like I'm there to help. So the book has been really powerful, and it's meant for patients, but it's also meant for people's families, just for anybody in general, because mental illness is everywhere. Every family is usually touched by it. And if you're not, you know somebody who is. And it's better to have the right understanding about it than misconceptions, because you can do harm if you have misconceptions. You can say the wrong things.
Yes, thank you so much for this book. I'm looking forward to read this, yes, and help people with your book, because it is definitely very necessary to understand what is going on. And when people get depressed, they feel that fight with themselves, that their brain tells them something that they understand that it is not their thoughts. For example, that they are not good person, that they are not good enough, that maybe their parents would be more happier if they had another child. So all these destructive thoughts, and people have that like intrusive thoughts that takes their energy. Yes, because initially they start fighting because they know that it is not true, right? Like it is a different, like two different brains inside. One says that it is not true, I am good, my parents love me, and another says, for example, no, you are so bad. Like, and this is how people start believing, like, what is happening, that they start believing that nonsense, right? Like, because when parents tell, for example, to the child that we love you, and when we look from outside for the person, we think this person has everything, he should be grateful, he should be happy, and person inside feels such a battle and this fight, and this exhausts him emotionally, right? And then if the person doesn't get help, and in many cases it happens that people go to see specialists and specialists just cannot help, right? Maybe not right specialist, or maybe people just go to local GPs, and this is a very long list to wait to mental support. And what happening that people lose, like when it comes to that phase when they start thinking about suicide or commit suicide, it means that they fail with this fate, right? Like that negative talk wins, and people start believing that they are so awful person, they're so bad, and it is better to kill themselves in order to make other people happy. So it is like totally like when we look at this, we think it is just not logically right, because like parents love you, everybody love you, you're so good, so beautiful, but the person does this like self-destructing, right? Self-destructing dialogue, and it looks like the brain of the person works against the person and wins in those cases when people commit suicide. So could
Yeah,
you
that you're absolutely right about that, because we call it cognitive distortions, where these thoughts are coming in your head that aren't really true, but the patient starts to believe they're true, like you're a bad person, or you're worthless, or you're this and that. Maybe externally none of that is true, but the brain is very, very powerful, and perception is everything. And the part of the brain that's heavily involved with mood disorders and other psychiatric conditions is the limbic system. The limbic system is kind of the mood and anxiety center, as well as memory. All mammals have a limbic system. So that's why we have such a kinship to mammals, is because they can understand our emotions. And so emotions can rule our lives totally. And so when the emotions go awry with depression, they rule the roost, so to speak. And so we can talk till we're blue in the face about you should do this, you should do that, you should be grateful. Look at what you have. You've got this great spouse, or you've got these children, or you've got whatever. None of that rings true for the person experiencing it, because deep inside they feel terrible. And sort of like if you had a really bad flu and I just told you, well, look what you have. You have this great life. Why are you feeling this way? That would be patronizing you and saying you should just get over it. But you can't, because you have the flu. And only till the flu runs its course that you feel better again. But when you have the flu, you feel terrible and you don't want to do anything. Depression's kind of like that. And so it's unfair to expect someone just to overcome it because they have such great circumstances. That's just not how it works. That's how biological this whole thing is.
Yes, so because when people don't understand that and continue just like convincing the person that he has to be happy and grateful, it brings even more guilt, because that person start feeling guilty because he make other people sad, and that initiates another, like another wave. Yes, like to that what he was experiencing, he start also experiencing guilt and feeling that he is burden for his family or other people.
It just reinforces their depression more. It's like telling a diabetic, just get over it. You know, you don't need that anymore. You just need to try harder. That's not okay. And that's the same with these things. The brain is just an organ, and it gets ill just like the kidney does, or like the pancreas does, or other organs. And so we got to be careful with what we say. The words really matter. And we need to be supportive and encouraging and try to get people into the right professionals. That's always the challenge. But if we do, we can get good results. But again, there's a barrier to treatment. Getting into professionals in the UK, you've got socialized healthcare, and that's good on the one hand. It's free. On the other hand, it might take a while, right, to get in. There might be a waiting list to get a specialist, and got to go through your GP first. And so there's these barriers. But the more you understand, the more educated you are, the more you're going to advocate for yourself.
Yes, I think that maybe another book which is good to write is for people who have someone who has depression. Yes, not only for people who have depression to understand what is going on with them, but also for their like so-called parents or family members to
And I do talk about that in the book. I talk about what families can do in these different disorders. In fact, families are involved in these stories. And at the end of the book, I go to fairly extensive detail on how you talk with and support somebody, either in your family or somebody you know, with mental illness. What words do you use? What's going to be helpful, not harmful? And I do think about writing a book about more of a family guide, but there's quite a bit in this book now. So I think that people will have a tool or resource to use in that regard.
Yes, and maybe you can share just shortly here what people can do, like parents or spouse, like what is the best they can do if they have their loved one
I think that first of all, you have to tone down any sort of judgment around people. It's just not fair to judge. It's not fair to say, well, if you just did this, if you just do that, or you need to just get over it. That's extremely harmful. So you got to avoid harmful language. Or if you just, I hear this life, you just pray more, or read your scriptures. And well, those things might be helpful for normal life for somebody. It's not helpful for mental illness. So you have to be careful what we do. We have to send the message that we care about somebody. And we may not be experts, but I sure want to see you get help, and maybe get a professional, maybe get someone who can figure out what's going on and help you. And I support you doing that. Now, of course, the mental illness people can have some negative behaviors. They can do things where they cross boundaries, and it's okay to set boundaries if you're a loved one. It's okay to say, I really love you and care about you, but you can't say this to me, or you can't do this to me because it's harmful to me. And I really want to be there for you, but it makes it hard when you say things like that. So it's okay to set boundaries. You don't want to be walked over by anybody. And that helps them as well. They need to know where the boundaries are. So that's helpful. So it depends. Some of these more severe mental illnesses where there's psychosis involved, then it gets a little trickier. But you also, you have to just be careful what you say. You can't just tell them to get over it or just do this or that's not really true. You have to say, well, I see that there's some serious things going on, and I really think you need to get into a professional and get the help you need because I care about you. So whenever you have that kind of message, you're a safe place to go for that person. You're safe to go there. May not agree, but at least you're safe. And that's important. I mentioned this in my book. I have two sons who've had mental illness, pretty serious ones. And we've always been a safe place for them to come. And when they got sick, where do they go? They come to us. Not because we judge them, but because we care about them. And we give them the same message. You need to get in and get that help, get the professional going. I just try to be the father rather than the physician. I'm not their doctor. And so it works. It works that way. And so one of them listened to us better than the other and had not such a good outcome. But he came to us, always came to us when he wasn't doing well. And he knew that that was the safe place to come. But again, we had to set boundaries as well. So it's a tricky little dance, but my book does cover quite a bit of that. And it does it in a story fashion so people can it's relatable and it resonates with people.
Yes, thank you for sharing. You trained under Dr. Nancy Anderson, a National Medal of Science recipient. So how this research shaped the way you approach patients differently from more opinion-based mental health approach?
Well, I was fortunate because when I was doing medical school, I was at the University of Iowa, and they had one of the premier biologically oriented programs in the country. And Nancy Andreessen was on staff, Don Black, who's a great colleague and well published, William Coriel, and George Winokur was the department head. These are really respected researchers. Nancy Andreessen was interesting. She had a PhD in English, but she was also an MD, so she was very well written. And so she was very interested in schizophrenia research. And in 1985, I was a senior medical student, and she was doing MRI research, which is brain imaging, and MRIs had just come out. So she was imaging schizophrenic brains, and that was like cutting edge research. And her area of interest was schizophrenia. And so she's famous for coining the terms negative and positive symptoms. That was from Nancy Andreessen. We use that all the time now, all over the world, and that's because of her work. So I was tasked with, we had these scans of schizophrenic brains, and it was more primitive back then. We'd have a projector, we'd project the image onto a table with graph paper, and I would take a pencil and then I would outline all these areas of the brain with this image. And then we would compare it to normal brains to see if we could find any anatomical differences between schizophrenias and normal brains. And so that was my involvement with her, but also she was one of my professors. So I would go to her lectures, and she wrote the book, The Broken Brain, which became a bestseller. And my book is kind of almost a spinoff of that. She wrote it for the public, a very well written book. I don't know if it's in print still, probably still is. But she eventually got the National Scientist Award from Bill Clinton, and that's the most prestigious award you can get in medicine. So it's a big deal. But I just really felt fortunate to be working with these high-level researchers at that stage of my career.
David, what is the best way to get really right professional diagnosis? We know that sometimes it happens that people go to see doctors and they get diagnosis which is not right. Yes, and then they get treatment for years, and then someone else finds out that the diagnosis was put wrong and a reason is something else. So what you would recommend for people who have these mental problems and really want to get the right diagnosis? To know.
Well, that's a great question. I still struggle with that myself when I see patients who get the wrong diagnosis and they struggle for years, sometimes decades, of the wrong treatment. I'm very careful when I see a new patient to try to get what I call out of the trees a little bit and see everything. So I ask a lot of questions about not only their symptoms right now, but their symptoms over time. And I always have what I call a psychiatric review of systems. I ask about mania and psychosis and OCD and depression and medication response. Also, family history is very critical because a lot of these things are genetic. So I say to patients, these things don't fall far from the tree. So if they have, say, depression running through the family, there's a high likelihood they have a depression. If they have some bipolar in their family, there's a high likelihood they're at risk for that. Now, if they're not showing symptoms, then I can't make the diagnosis. So to answer your question, I think this is the challenge, is to find specialists that are good at what they do. And how do you do that? Well, word of mouth, of course. Look at reviews, look at things to try to determine the best person, because it's critical. If you go to the wrong person, you could be going down the wrong path for a long time. And our lives are too short. We want to be on task, and we want to be happy right now. We want to have that happen moving forward. We don't want to have 5 or 10 years of not being happy or being off. So you kind of have to be your own advocate. You have to kind of be, I'm selfish. I want to go to the best. I want people who are going to get to it. And if it costs me a little bit more, so be it. At least I'll be on the right path for the next 10 years. What's it cost to be on the wrong path? If you want to save a little bit of money by going through channels and you save some money, but then you're on the wrong path for 10 years, that's going to cost you a fortune in lost time, lost relationships, lost money. So it's really important to go to the best if you can, where possible.
Yes, and I believe that you might have maybe the circle of professionals who you trust, yes, and who you can recommend or refer to other people.
Yes and no. I mean, I don't know other communities very well. I know my community because I'm pretty focused on my work that I do in my community, and I know that community quite well, and I know all the professionals. Outside of that, I know some famous people here and there, but if people ask me, well, I'm moving to Seattle, how do I find a doctor? Well, several ways. If you're looking for a psychiatrist, try to find one who's on a medical staff, because that screens people. You have to be board certified. You have to have peers looking over your shoulder. It's a higher bar. And then look at the reviews, do some word of mouth, ask other physicians about them, do some homework. And that's what I recommend, because it makes a difference. It makes a big difference who you see.
Yeah, definitely. Looking ahead, where is psychiatry going to be in the next 10-15 years? What breakthroughs give you the most hope for people who feel like they've run out of options?
Another great question. I think that there are several areas that I'm excited to watch. One is, of course, the brain stimulation techniques continue to evolve. We continue to find new uses and better ways to use it. Secondly, it's the genetic side of things. Because these illnesses are quite highly genetic, what is the genetics of it? And can we reverse that? Can we do some sort of gene therapy that we could take somebody who's bipolar and reverse it? Or someone who may be schizophrenic? Can we do genetic therapy that we can reverse this? Because these are tough illnesses and they really affect people in a terribly negative way. And especially schizophrenia, if we could find a way to reverse that or to make changes that would make a difference, that's what excites me. We're actually getting into the weeds of the brain, of how it works and how it's affected. The genetic blueprint is so powerful. It determines a lot of who we are. And we're kind of, I'm not saying we're robots, because environment does play a role, and we can be an author of our destinies to some degree, but genes are super powerful. And so the more we understand our genes, and now we can get our genes sequenced now, our complete genome sequenced for $300 to $500, which is unbelievable. That's how far we've come from discovering the DNA in the first place to now being able to sequence this massive genome I think that the future, especially with AI and high technology, it's going to move much faster.
Yes, thank you so much. What we've learned today is powerful. When we understand the brain, we remove shame and restore hope. And mental health is not about weakness, it's about awareness, courage, and the right support. And Dr. Kent, thank you so much for your helping us think bigger, act wiser, and approach recovery with clarity and compassion.
Thank you.
And before we wrap up this episode, is if there is some advice maybe that you would like to share with our listeners, what would it be?
Well, I hate to be, this is a kind of shameless plug, but I think my book really says it all. And so I can't, in 5 minutes, I couldn't say what's in that book. It's really a good guide. It's also really readable and relatable. And I tried to have an emotional impact on it. So I think you start with that. Plus, at the end of my book, at least in the US, I have an appendix with a tremendous amount of resources for people, where they can turn, where they can go, what organizations, what books can they read. So I've got a huge amount of resource in that book, but it's not a lengthy book. You can read it in about an hour and a half. So, but it has a lot of good information. So I would really start there. And I think that'll give people a lot of good insight and good knowledge that they need.
Thank you so much, Dr. Kent. And if our listeners would like to contact you or maybe follow, are you active on social media? With social media, they can contact you, or maybe also do you see clients online? How to approach if they would like to?
Yes, I have a website which is newmetms.com, and they can contact me there. But my author website, which is davidkentauthor.com, that talks about my book, talks about me, but at the bottom there's a contact email there. You could certainly use that to contact me, ask questions. If I get enough interest, I'll start a newsletter and start putting out regular information. Then maybe I'll write a second book. Who knows? But right now I'm plugging this one. So, but you can get a hold of me that way. My book is mostly all over the world, English-speaking countries. It's all over the world at this point. Like I said, there's an audio version, which is really nice. And I used a Belfast narrator who's awesome. So, but go to my author website. I think that's a good place to start.
Yes, thank you so much for being an amazing guest and sharing your knowledge and experience from 35 years in this field. And we are looking forward to see you again in our future episodes.
Thank you so much. I appreciate it.